Good morning, good afternoon. Welcome to another episode of QRA Live with me, your host, Jimmy Yen. And we are about to get started. Let me get the chat ready so I can see everybody's chat. Let's see here. While I am getting this ready, let's go over a couple of disclaimers. So QRA Live. QRA Live is all about answering your questions. Type into the chat any chronic health condition that you're struggling with, that you need help with. Whether you've already been to other practitioners, you've been to so many different specialists, you've been into a million specialists, and they've done this test, blood test, this ultrasound, MRI, whatever, and you maybe got a little better, but you're still not significantly better. You're not where you want to be. You haven't achieved the results that you want. Maybe the physician has achieved the results they want, but it's not the result you want, and you're like, what else can I do? This is the place. This is the place to ask your questions. Because this is what we do in our clinic at Achieve Integrative Health. We help our patients achieve the results they want, not what we want, but what they want. Okay. And so you can ask a question. I can help guide you. Maybe you need to go see a different type of practitioner. I can help you think through the process or explain to you what is the process, right? Or QRA is quick restorative acupressure. If you want me to show you a QRA, a quick restorative acupressure on how to almost like instantly reduce your symptoms, then this is the channel, this is the show, this is the place to do that. Now, disclaimer, I am not a physician. I was not trained in prescribing medications or doing surgery. So anything that I share is not medical advice. It is only real experience on real patients that we've done in our clinic, that we've helped our clinic. I'm just sharing you a testimony. I'm sharing with you what we've actually done, not something that I read on PubMed, not something that I Googled. A lot of physicians, doctors, practitioners are going to PubMed.com, doing a lot of research, trying to pull research and say, oh, but research says this. So what you say is wrong. Okay, that's not this channel. We believe in what our patients say. On a side note, I get censored, once in a while by all these social media channels, and they have these so-called third-party fact checkers. And I was communicating with one of them. I was actually, um, arguing my case, and they were like, where's your proof? Where's your proof that what you said, that your QRA actually works? And I said, yeah, you want to go to my YouTube channel and look at the proof of real patients sharing their success, doing what I'm sharing on social media. And this is what the third-party fact checkers, okay, this is what Mark Zuckerberg, even Google, right, even YouTube, they're third-party fact checkers, what they say. They say if there is no scientific research, then what I'm saying cannot be proven, I cannot prove that it is accurate. It is accurate information. I said, what about the patients who are verbally saying on video that what I shared with them actually works? So third-party fact checkers, they don't believe in you. They don't believe in what you say. They only believe what's done in a laboratory. Okay, which kind of pissed me off. But that's why I do these channels, because I want to give a voice to patients, because the scientific community doesn't trust in your voice. You said you tried something, regardless of how crazy it sounds to someone else, you tried to drink a juice and it healed your arthritis in your knees. Well, the fact checkers in the scientific community, the medical community are saying, okay, but that doesn't prove that it works. Even though you were sitting in a wheelchair, you couldn't walk, you drank this juice, and now you're walking. That's proof enough for me. Okay. I don't know why it's not proof enough for other scientists. Okay. So I'll get off my soapbox. Type into the chat what you want me to help you with. QRA It could be QRA. It could be just information about how to navigate your condition, or maybe your loved one's condition. Like currently, my father's in the hospital right now, and so I'm trying to navigate the I'm trying to help him navigate because the physicians, all they're doing in the ER, and I'm in Taiwan. It doesn't matter where you are in the world. Western medicine is a broken system, and so it doesn't matter where country you are in the world. I had the same experience with my mother-in-law. I had to navigate her healthcare in the hospital, even though I'm not trained, right? But because I've treated thousands of patients, I know which medications, okay, have this side effect. You got to be careful with the medication. And so I had to go through that with my mother-in-law. Now I'm going through it with my father. Same Western medicine system, right? They're trying to kind of regulate his blood pressure, and they're causing problems by just giving him more and more medication. Okay. So let's start. We got people. Sharon, thank you for joining in. Ricardo, thank you for joining in. I'm going to jump right in. Okay. I only got 20 minutes. My knees are so sore, stiff, and painful. What should I do? Okay. There's a number of things you can do, right? The first thing, Sharon, hopefully what you've done is gotten an X-ray um, of your knees, at least an X-ray, preferably an MRI, but at least an X-ray. And what you're looking for in the X-ray is your joint space. So the knees are like this, right? And so the joint space is in between here, in between here. So these are your knee joint, right? They go like this, they bend, okay? But more like this, they bend like this, okay? So you're looking for how much joint space in the X-ray that you have. A lot of times people, let's just, for example, let's say the normal joint space is this wide. Yours, a lot of people with knee pain, chronic knee pain, their joint space is this wide. So sometimes when you bend your knee, right, see, it hits bone on bone, and that causes pretty excruciating pain, sharp pain. It'll stop you in your tracks, right? That's the purpose of getting an X-ray. You can get an X-ray from a chiropractor. You can get it from obviously your family physician. So Western medicine has great diagnostics. Use them. I love them, right? I love Western medicine diagnostics. Use them. You don't have to use your treatments, but use them, right? Um, so joint space, if you go to your physician to do it, they're going to prescribe steroids. They're going to prescribe NSAIDs. Steroids, be careful. They may help you, but they're thinning your bones and making this joint space worse at the same time. So what can you do? You can eat. You can do, first of all, you can do injections that have, if this is the problem, okay? There's many problems. There's many causes to chronic knee pain, but get an X-ray first. If it's your joint space, if your joint space is too small, there are cartilage injections that can temporarily push that joint space out. Now, that cartilage, they get it from a rooster's comb. Okay. I know because I used to have a medical team at our clinic, a physician and a nurse practitioner. I hired one to do some joint injections, right? These are not, they don't solve the problem. They give you, if it works, it gives you about 6 months of pain relief of increased joint space, to maybe 2 years. I have one patient that 2 years relief, which is unusual. Usually it's just a few weeks to maybe a few months. So do that first, right? That will give you time. If this is the problem, that will give you time to do physical therapy to strengthen your muscles. Okay. And it will also give you time to eat the right things, right? I don't know if you like here in Asia, they love to eat pig's feet. Why? Because the gelatin in the pig's feet, the tendons in the pig's feet, you want to get some tendons, right? Eat some tendons. It doesn't have to be from a pig. It can be from a cow as well. So why? Because you want to replenish your tendons, your ligaments, right? The cartilage. So you have the cartilage in between your joints, in between your knees. How do you make those cartilage repair? How do you get your body to repair them? One is to feed your body cartilage. 3,000 years ago, Chinese medicine found that if you have a problem in your body, like cartilage, then you just go eat the cartilage of an animal, and it will, because it contains all the nutrients your body needs to take that cartilage, the animal cartilage, and make new cartilage for yourself. Okay. Again, that injection I just told you, where do they get it from? Cartilage from a rooster's comb, right? So Western medicine, even it's kind of, I don't want to get on a soapbox, but it's kind of funny. So these cartilage injections, the most popular one's called Synvisc. Western medicine believes in this, but yet it's kind of weird. They believe in this. You can get a rooster's comb and inject it into a knee and it will help. So why not eat it? Right? I don't know about eating rooster's comb. I've never tried that. Don't do that. Oh, you love pig's feet. Awesome. Eat tons of pig feet, and it will give you, especially for women. So in China, my wife is from Shanghai, and so it's very popular in China. You know why? Because it makes their skin elastic. So you can reverse aging and help your knees at the same time by eating pig's feet. Okay. Um, so that's one thing. Now that still doesn't fix it. Okay, I'm just giving you all the things that I tell my patients. We tell our patients in our clinic to do. If you really want to fix it, you have to also fix the organs that control the healing of your joints. So you got bones, right? You got deterioration in your bones. That's your kidney function. And then you got the cartilage, your tendons and ligaments. That's your liver function. So you have to go do blood labs, okay, that test your kidney and your liver function. What are some basic blood labs that can do that? Something called, it's these are routine blood labs, comprehensive metabolic panel. Okay, these tests, and they give you tests that show if your kidney and your liver, right, might be dysfunctioning or not. Do these tests tell you everything about your kidney and liver? No, they don't. But it's a starting point, right? It's a very inexpensive test. It's less than $10 if you're paying out of pocket. Okay. So it's called a comprehensive metabolic panel. It'll tell you about your liver. It give you clues about your liver and kidney. You can also do some liver enzyme tests that will tell you if you have liver damage. Okay. You can do a urinalysis, a more detailed urinalysis that will give you, again, more signs of a kidney, if how your kidney's functioning, right? Now, that just tells you, hey, which is the problem? Now, if you don't have access to someone who can diagnose you using other methods, like in our clinic, I created a pulse diagnosis called functional pulse diagnosis. Using my functional pulse diagnosis, we can tell our patients which organs are dysfunctioning. I actually, our team can tell our patients what blood labs to get from the pulse because I can tell which organ is dysfunctioning, and then I will tell them, hey, these are the blood labs to do. But if you can't come to our clinic, then the next thing is to do these blood labs, which I've just said. Okay. If you missed it, just rewatch this episode. So fix the liver and kidney. Now, how do you fix the liver and kidney? Here are some general things you can do. The kidney is a water organ. So how do you fix the water organ? You eat foods that contain a lot of water, right? So many fruits, vegetables contain water. So you can eat like watermelon, cantaloupes, honeydews, peaches, plums, grapes. These are all full of water, right? You can blend them. I would blend them like with celery, carrots, you know, vegetables that have a lot of water in it. You blend them, okay, okay, and then you can that will help your kidney function. Now, what will help your liver function? Cruciferous vegetables. Cruciferous vegetables are one of the best foods for your liver. Okay, those are the broccoli, cauliflower, baby bok choy, uh, Brussels sprouts. These are called cruciferous vegetables. Okay, so these will benefit your liver, right? Here's another thing: black foods that are naturally black. Okay, so like grapes, right? Plums, or darker purple. I don't even say black, or darker purple, right? What else? Eggplant. These all benefit the kidney. Foods that are more green, vegetables, that's why they're vegetables, green, even bell peppers, they benefit your liver, right? Now, these take time though. Eating food to help your arthritis in your knees or just your knees, right? That still takes time, right? It takes time. So you can do acupuncture, right? In our clinic, we do quick restorative acupuncture, which is completely different from other acupuncture. I'm not saying other acupuncture it doesn't work. It can work, right? We just I used it before. It wasn't fast enough for my patients, and the success rate was not high enough. So I had to create my own acupuncture technique, which is called quick restorative acupuncture. Okay. So uh, physical therapy. You cannot escape physical therapy. You have to do physical therapy. Even if you see a Chinese medicine practitioner like our clinic and my team, you still need physical therapy. See, because I want, I want in our team, we want our patients to be able to heal themselves, not even be dependent upon us. So that's why we tell them all these lifestyle habits, lifestyle changes. We tell them these dietary changes, right? Because those are the things you can do at home, right? So physical therapy, learn some exercises to do that. Do not run. Running is, here's one of the things. If y'all don't have knee problems yet and you're a runner, you need to stop running. Running is the worst exercise for your knees. It was made popular, I think, by Nike. Nike made it so cool because trying to sell some shoes. But do not run. Can zucchini substitute for a cucumber? I am allergic to melons and those of the melon. Yeah, you don't have to do melons. Any of the fruits. And zucchini, yes. You zucchini, cucumber, they're all great. Okay. You want to other actually there's just so many different types of fruits. You don't have to just do the melons. Okay. The peaches, like I said, peaches, grapes, apples sometimes actually have pears, lots of fluid. They benefit your kidneys. Okay. Here's another thing. If you have bones, this is what I tell our patients who are in the hospital or have bone issues. Bone broth. Since Sharon, you like pig feet, you probably will like bone broth as well. Actually, in the US, it's been a super craze. It's like the new thing is to drink bone broth. Chinese people have been drinking bone broth in Chinese medicine for 3,000 years. Okay. It's just recent in the past 5 years or maybe 10 years in the US that it's starting to get popular. Bone broth also has, like collagen supplements, right? Chinese medicine has been doing this for 3,000 years, right? So get some bone or just get some bone broth. Bone broth has bone marrow. Marrow can replenish your marrow, which will make your bones stronger. Okay. It will also help you. I tell people who are getting chemotherapy, cancer treatments, because the cancer kills all of their cells, red blood cells and white blood cells. I tell them to drink bone broth throughout the whole time to help replenish the red blood cells and white blood cells. Okay. So hopefully that helps. One last thing for the knees. QRA. I shared this last week. Joints. Look at all these joints in your fingers, right? So and the finger actually looks like a knee, like a leg, right? So if this you can treat this joint as your knee. This is your ankle. These are your toes, right? And this is your hip right here up top. So you can massage, find the most tender joints. You've got 10 fingers, so you can find the joints, right? Joints, find which of these joints right here are the most tender and squeeze on them and then get up and start walking. Okay. Because this will move blood by this QRA, quick restorative acupressure. This will move blood to your joints, nourish your joints, right? And decrease inflammation. So it gives you, if you're having trouble walking, you can push on this while you're walking and it will help you. Okay. All right. Let's move on to the next. Thank you everybody for responding. Leanne, good evening from Minnesota. Awesome. Faith, Hope, Love. Thanks for what you're doing. Much appreciated. How do you heal rheumatoid arthritis? So this is different from, let's say if Sharon has osteoarthritis, rheumatoid arthritis is a little different, okay, because of the cause. Osteoarthritis is a wear and tear. It's that we use it too much. We're running too much. We're running, you're using your joints, you're jumping, jumping around, playing basketball up and down too much, right? You're going to get osteoarthritis. Rheumatoid arthritis is actually your immune system. It's an autoimmune condition where it is attacking your joints. So to fix the problem, you have uh, to fix your problem, you have to address your immune system. You got to get your immune system to stop attacking your joints, right? So the fix is the immune system. So you have to think back, where does your immune system, what organs affect your immune system, right? The rheumatoid arthritis, very commonly, physicians will give them, the Plaquenil, the anti-malarial medications. They'll give the methotrexate. They'll give the chemotherapy medication. They'll also give steroids, right? Again, but those are making your joints more, they're making your joints worse, okay? Over time, if you take, I'm not saying don't take them. I'm not giving you medical advice. I'm saying what we've seen in our patients is when they take steroids, for any type of joint degeneration, their bones get worse. You go get a bone density scan 6 months later, you may not have any osteopenia yet, but after 6 months later, you will. Okay. And also you'll gain weight. A lot of people balloon up when they take steroids. So to fix your immune system is you got to balance your immune system. How do you balance your immune system? Well, part of the problem is there's many organs that control your immune system. The biggest one you need to focus on first is your gut, your large intestine and your small intestine and your stomach, but mostly your intestines. Okay. I'm gonna start. That's what I mean by gut. Yes, potentially you probably have most likely, high chance you have what's called leaky gut, which means stuff that's supposed to be, let's say this is your intestinal hole, and stuff that's supposed to stay in this hole seeps out. It leaks out. Where does it leak out? It leaks out into your bloodstream, which is one of the worst places to go. It leaks out into your abdominal cavity, right? So if you have that leaky gut, things that are in your intestines, like if it's in your large intestine, it's already poop, and the poop is leaking out and it's going into your blood vessel. Imagine that. Your brain is going to say, hey, I've got foreign objects in my blood vessel. I better send some troops to go capture it, right? And that starts the autoimmune process. Now, autoimmune does not happen overnight. It is because you have damaged your immune system over years, probably 10 years, right? You just ignored it. You had GI symptoms, your brain was telling you have gut problems, diarrhea, constipation, gas, right? You had gut problems. You ignored it. Maybe your stool got smaller. Your stool became watery, became looser. Your stool became hard like rocks, but you ignored those symptoms. Okay. And I'm not pointing this at you. I'm just saying this is very common what we see in our patients. So if you are already having gut problems, if you have allergies like allergies to pollen, allergies to food, you need to start fixing your gut. You are already developing an autoimmune problem in your body. For those of you who don't think you have autoimmune conditions, okay, you are already developing an autoimmune problem, right? It's just not flaring up right now. 10 years later, I guarantee you it will flare up if you do nothing about it. So, but coming back, how do you fix it? How do you heal it? How do you get your body to heal it? You got to fix your gut. Okay. You have to balance your immune system. How do you do that? I shared this many times. The balance of your immune system and the balance in your gut that you need to fix is the beneficial bacteria to the harmful bacteria. This is balance. If your harmful bacteria is the same as your beneficial bacteria, this is not balance. If it's like this, your immune system is already attacking. It's already sending troops to your intestines and already starting the attack on your intestines, actually. This is balance. Good bacteria always has to be higher than bad bacteria. So, okay. So you can start by eating fermented food. Yes, you can get probiotics, but if you're going to do probiotics, you need to switch out your probiotics. You cannot be taking the same probiotics every single month. Okay. I know supplement companies are now, a lot of them are owned by pharmaceutical companies. And so they want you to think, oh, this one bottle of probiotics is the best probiotics and you should take this forever. No, you can overpopulate good bacteria as well and make them harmful. So never take the same bottle of probiotics month by month. You always want to switch one after the other. Okay. So that's one part, but you can eat it through fermented food like kimchi, or fermented any type of vegetable. They do that in Korea, in China, in Taiwan, we do that as well. We ferment cabbage, sauerkraut, popular in the US. Yes, you could do some kefir, but I really don't like the animal dairy as much. But yes, you can do kefir. But fermented food, right? Fermented in Japan, fermented tofu, just any type of fermented food is phenomenal. It's natural probiotic. Okay. So that's one thing that you can do. There's a lot of things you have to do with autoimmune. It's a very tedious, it's not complex. It's just lots of steps, lots of things to do. It takes time. It's going to take at least 6 months to a year to really make a dent and to balance your immune system. But you have to work with someone that knows what they're doing and has the proven results. Um, and how do you know if they have proven results? Look at their Google reviews. Do they have video testimonials? That's why we do video testimonials. You look on our YouTube channel, we have we have hundreds of patients, live patients, okay, sharing their success. Okay, so let me move on to the next one to see. I only got about 3 minutes. Okay. Vamp, where are your clinics? Unfortunately, right now we only have one clinic right now, and that's in Austin, Texas. We do have people fly. If you live in the US, we do have people fly into Austin. They stay in Austin for 4 months and get treatments with us. We help them establish a foundation so that when they fly back home and they find another practitioner, whether it be another acupuncture clinic, they can that their local clinic can help them maintain the results that we achieved. Okay. In 3 months of treatments at our clinic, you will see a significant difference. Okay. Joanna, okay, you're back. Waking up with headaches still. Okay. Um, did you check your neck? Right. I would go and have first a x-ray of your spine, your cervical spine, your neck. Majority of headaches, over 90% of headaches are caused by cervical problems. The QRA is not going to fix it. Majority of the time, like recently I had my wife, and both my wife and I got x-rays of our spine, I think 4 or 5 months ago. Um, and we're doing it because we wanted we did it at a chiropractic. We did it because we wanted to do preventative care, right? We don't get headaches every day, but we do it for preventative. And thankfully, we went to get some x-rays because my wife, she's originally trained as a CPA and accountant. And during tax season, right? For those of you who are familiar in the US, tax season, in the first part of the year, from January to June, she's sitting down working 12 hours a day and she doesn't get up. So she has a sitting syndrome, sitting disease. Her spine is all messed up because of sitting, right? And so she didn't do anything. She just sits and her spine is almost straight, right? Which will cause a lot of problems, right? So if you lose a spine, a normal spine in your neck should have a curve. It's also what's called tech neck. A lot of tech people on the computer, right? Especially post-COVID, people are on the computer now. They develop tech neck, which means their spine starts to straighten up. If you spine straighten up like this, you will get a lot of headaches. Not everybody does, like my wife doesn't, but you could. So I would get an x-ray, a minimum an x-ray of your spine and see if it is, you need to go see a chiropractor to help you. It's going to take a long time to, to even put any type of curvature back into your neck. But you will need to see a chiropractor. You can also do physical therapy. Usually, this is what we do in our clinic. We recommend, if someone who has chronic headaches, we recommend they get an x-ray. If their neck has impingements, like even in your spine, the space between your vertebrae, if they're shrunk, that's a problem. You need chiropractic to move it back into place. We use acupuncture to move blood to the area to nourish it, and then they need to go to physical therapy. Physical therapy is the fix, something that you can do at home. It's the same thing with the knee osteoarthritis. You go to physical therapy to learn the exercises to strengthen the muscles in your neck, all right? And to move your posture of your neck so that your spine doesn't move out of place all the time. If your spine is straight, you have instability in your neck. Instability means your spine is shifting, which in the ways it shouldn't. It should only be moving kind of like this, but it's shifting forward, shifting back, shifting side. All of these shifting, right, are abnormal, and it can pinch on the nerve that goes over your head, gives you the headache. So you need to really focus on that. Fixing that would be the root cause. Okay. Now there's other things that can cause it. Okay. Joanna, I don't know your cause, but I would say go get an x-ray. Let's rule that one out first. See if you can get that before next week, and come back next week. I will be back here next Sunday. Okay. 5 p.m. Central Standard Time, 5 p.m. Central Standard Time, 5 p.m. Central Standard Time. I'll be here, report back. And if that's not the cause, then I'll share with you other causes. All right, guys, I need to leave. But thank you for joining. Thank you for all your questions. I want to be able to answer everything. Come back next week. Same time, guys. Same time, same channel, same bat time, and repost. Get in earlier. So I will go over your question first. All right, guys. Thank you for joining. Get your friends and family to subscribe. See you next